Hey guys, welcome to another exclusive webinar with Expatrio. This is the episode 3 of the webinar series that we are having with them. And especially with this entire crazy time that is happening in the world with so many rule changes and ups and downs happening, I personally feel like that this webinar series has helped the audience a lot in just keeping you up to date on how, for example, the blocked account and health insurance sectors are seeing the shifts in regulations and so on. And Dom has also been very careful with what he has to share, and also has been very transparent every single time with the audience, which is of course always important. So with that, Dom, thank you so much for joining us in this webinar again. What is Expatrio? What does it do? Tell us a bit about it, and then we jump into the explanation of the German health insurance system.
Sure. Thank you for being here again, and hello to everyone who is joining. As always, hope everyone is still safe, family is healthy in these special times. This is the most important thing. But of course, I will also answer the question Bharat asked me. So, what is Expatrio? Our slogan is relocation made easy, which means Expatrio is a relocation platform for international students and expatriates wishing to live in Germany. So exactly you guys. We offer an all-inclusive service to minimize the bureaucracy students face when moving to Germany, which means there's a customized digital solution enables you to open a blocked account and get health insurances. And as Bharat said, today we will dive into the health insurance system a bit more, because those two German visa essentials can be easily secured while you are still in your home country. Yeah. And of course, and this is also super important, Expatrio service is approved by the Federal Foreign Office here in Germany. There are different products we are offering. As blocked account, which is fast, cheap, and secure, which means you will receive your setup of the blocked account within less than 24 hours, for example. Currently, we are also working on a bit faster solution, which means that you will receive those confirmation letters within minutes. We are cheap, which means we are offering a super cheap setup and low monthly fees blocked account. And as said, security also super important. As you can see on the Federal Foreign Office side, we are officially approved. Then, of course, it's also important that you, while dealing with important questions, maybe, are receiving super fast answers to your important question, which means we have a 24-hour response guarantee. Our process is fully online, and we are also offering a so-called online portal, which provides every information you need regarding the products you can apply for in your individual login portal. And this is also super important because this is a really high security standard, because we do not send out any document with sensitive information to you via email. You can easily log in. They will also find all the documents you need to provide during the full process, from the visa application till the arrival day, till the activation of the insurance and whatever. And the good thing is you can also upload everything in this portal, and this is super nice. Then, of course, there's the health insurance, which is two parts. One is the incoming insurance, which I will explain later. And then there's also public health insurance, which I will explain in a few minutes. And in our health insurance package, you will also receive some free benefits. Important, and I will let you know already, we are working with Techniker Krankenkasse, which has been awarded as Best German Public Health Insurance by Focus Money. I guess 14 times now in a row. And as you're students, it's also important that Techniker Krankenkasse has also been awarded as Best Health Insurance Funds for Students by Focus Money. Dr. Walter, our partner for the incoming insurance, has been awarded as a star insurance provider, which is also super nice. And they're doing this business more than 6 years, so also well-trusted partner around the world. But let's dive into the public health insurance. So as you maybe know, Germany has an excellent public healthcare system, especially in these hard times during Corona, I guess. We show everyone that people are able to live quite safe here in Germany. If they need medical support, they will have great medical support. But public health insurance in general is paid for kind of combination of employee and employees, which means employees need to pay 7.3% of their gross paycheck, and the employer is also paying 7.3%. I will let you know, and I will show you how much this insurance in general costs. It is mandatory here in Germany by law for every German resident to have a public health insurance, or a little percentage of the people are able to apply for private insurance, so for private coverage. In general, we can say around 90% are using the public health insurance here in Germany. So as said, employed workers pays normally this 7.3% of the gross paycheck. In general, it got matched by the employee. So this total payment of the public health insurance is 14.6%. So 14.6% of what? So this is exactly what I will tell you now. Let's say there's a person with a salary of 3,000 euro gross. This person, just the person, need to pay more or less 300 euro per month for the public insurance. And of course, the employer will pay the same. So let's say, to make it easy, it's around 600 euros. So now you will maybe ask you, okay, why he's telling me this? Because now I will let you know how much students need to pay for the public healthcare costs. So there are some rules before we can figure out if a person is able to apply for this cheaper student health insurance via Techniker Krankenkasse. So students can pay a set and a discounted amount of the same healthcare as employees receive. So it's completely the same. There's no difference between students or employees here in Germany. Some rules: non-EU students aged under 30, and so you need to be a student under 30, and you need to participate at a study program on a university which is state or state recognized. So non-EU student under 30 studying at a state or state recognized university are able to apply for this. And now I will let you know about the payment, because this is quite cool. You just have to pay 103.94 euro up to 105.80 euro. In the very beginning, it sounds like a lot, but compared to employees here in Germany, it's much less what people need to pay for this. Bart, you're smiling.
Because
I know.
Dom, I know the pain of public health insurance, especially like when you're self-employed. So I would be paying, as soon as my student status ends, I would be paying somewhere around 720 euros per month. So, which is again like a lot of money. And if you're a student, like you get all of the benefits, like just with 105 euros and 80 cents. So, you know, it's definitely nice to be a student and like get all those facilities just together with TK.
Yeah, absolutely. And this is nice assist from your side. So thanks, because now I will let you know what is covered by healthcare in Germany. So you can, let's say, to make it easy, you can go to dental care. So if you have an appointment and a dentist, not a problem, you can go there. You do not have to pay in advance. So everything will be paid somehow behind you. You do not have to send any bill to Techniker Krankenkasse or whatever. Everything is directly paid from Techniker Krankenkasse to the doctor. There is in hospital treatment, outpatient treatments. Vaccination is included. There you can check which kind of vaccination. As said, if you need to go to a doctor, just go to a doctor. Don't forget your card. So it's super easy. And of course, it's also an option to have additional private health insurance plan, which means if you say, yeah, I need 4 times a year a private room for hospital visit. In those cases, it makes absolutely sense to also apply for private health insurance. But then this is the thing I have to share with you. You have to pay for additional insurance. But in general, yeah, everything is more or less included. So can I choose a doctor or a practitioner? So this is also one question Bharat asked me before we decided to talk about this topic. Get an appointment with any doctor. You just have to take care that this person is registered in the public healthcare system. It's called Kassenärzte. Then you are on the safe side with no surprises that someone will charge you a lot of money. So if you go to the doctor, make sure that we're talking about so-called Kassenärzte. Just a hint from my side, you do not have to make an appointment, but without an appointment, you should bring time with you, because sometimes it will take a lot, because they're also very, very scheduled. And if you have to go there, you can sit there, you can wait there, they will help you. But if you can plan this, for example, for skin cancer testing or whatever, so skin cancer screening, make an appointment, and then you won't have to wait that long. This is also quite important. Then you also do not need a doctor referrals to visit, for example, kind of a chiropractor. So you can go there. Maybe this depends. The person will ask you for some additional money, but in general, this is also paid by the Techniker in this case. As said, always makes sense to get in contact before making an appointment, saving some time.
Yeah. Absolutely. So, just a quick thing that I wanted to add here. So, I think my experience so far with the German public health insurance system has been very nice. Especially like at the time I had my kidney stones issue. Like it kicked in all of a sudden one morning, and then Alina had to run, call the ambulance. They came, then we went to the hospital and everything. And for all of that story, I just had to pay 10 euros for the ambulance, and everything else was covered by the health insurance. So these kind of things are really nice, and also no charges by the hospital whatsoever. Everything was covered by TK. And so in case you have some issues like that, with such a cheap rate at student prices, you're able to afford all of those facilities.
Yeah, and you got a free ride in the ambulance.
For 10 euros. Yes, that was cool. That was the only nice thing about it.
All right. So then, of course, one major question after this this joke, how to find the right public health insurance provider. This is not that easy, because in Germany we have more than 100 non-profit insurance providers like Techniker Krankenkasse and so on. As said, Expatrio is working with them because we are always working with the best, which means TK, as said, is the largest and most popular, as well as award-winning public health insurance fund in Germany. More than 8.8 million people are registered in Techniker Krankenkasse. I already said this, but just to let you know again, Techniker Krankenkasse has been awarded as the best German public health insurance by Focus Money. It was Focus Money 720, if someone would like to find it. And same is the Techniker Krankenkasse also has been awarded as the best health insurance fund for students by Focus Money. This was in Focus Money 1720. So we help you to find the right public health insurance provider with Techniker Krankenkasse. And then, as said, we already spoke about the benefits. There are also a bit more things. You can also be part of the so-called illness prevention program. So this is for people who are doing kind of preventative health, for example, which means you go to a gym, you're an active member in a sports club or whatever, you do fitness or kind of mental well-being programs. All things like this will give you some additional points in the TK bonus program, which means at the end you can save money, or you have free choice of going to chiropractic or whatever. So there are many additional things. It would take too long to dive into this. What I would recommend is Bharat will share a link afterwards where you can read exactly what you can receive. This is super nice.
Yeah.
And then it is also important because, of course, you're not native German, or most of you are not native German, that someone will help you if there are some questions, which means Techniker Krankenkasse also provides excellent online support for you in English. This is quite good. You can also download an app where you can download, for example, the certificate of your study program enrollment. So the confirmation that you are insured at Techniker Krankenkasse, because the university, for example, will ask for those documents quite often, and everything is in the app. You do not have to get in contact with them all the time. You can just easily download the PDF, forward this to the university, and that's it. If you are planning to travel within other European countries, you will also receive the European health insurance card. And this is super important because the European Health Insurance Card, EHIC, is a card for 31 countries who find healthcare agreement here in Europe, more or less. Which means, for example, the National Health System, NHS, in the UK, people can easily go to Germany using the healthcare here, vice versa, which is quite nice. You just have to show your card. Bart, you also have one, I guess, and if you have some additional question regarding like this, how it looks like, we can also show you. Then, of course, what does the EHI covers? As said, the European Health Insurance Card allows registered individual access to basic or emergency medical treatment when visiting another member state. Let's say we will meet in Denmark, for example, Bharat and I, and something happened with me. I just have to provide my German health insurance card, and they will help me. Same if I would go to France, or French people will come to Germany, or you later on will also travel around Europe. You are covered. So students should apply for public or for public healthcare cover before they arrive. In fact, this is essential for being granted also as a student visa. This will save a lot of time.
Yeah. Absolutely.
Then how can I apply as a student for the European Health Insurance Card? So, as said, if you are using our service, you will receive, after a successful application, you will automatically get a card when you register, which means for this, there are a few things you have to send to us. We will ask for your IBAN, which is a current account. Then we need the certificate of enrollment to make sure that you are official student, and we need the German address. And then you will receive, so once we receive those information, you will receive your European health insurance card within 2 to 4 weeks. So in peak times, maybe it will take a bit longer, but don't worry. If you need to go to a doctor during this period, you can easily ask Techniker Krankenkasse, for example, for a special letter. They will provide you, and then you can go to the doctor, and the doctor will help you. So this is not a problem at all. Of course, I could also share some of the member states. As said, the list is quite long. If you are interested, Bharat, maybe we'll just upload it into the group, and then people can see, and maybe you can already plan your trips where you would like to go, with a nice coverage of the insurance. This is the public health insurance. As said, the public insurance will cover you once you are an official student, but for the visa, and you have to deal with visa requirements, the blocked account, and also a so-called incoming insurance. You will also need, as said, an incoming insurance, and there we are working with Dr. Walter. And the product they are offering is insurance, which is accepted at the embassies. Maybe some of you deal with this little issue facing in New Delhi. So this is also fixed, because we directly discussed with the head of the embassy that we do not understand why an official German insurance provider who's doing this more than 60 years is not allowed to offer the product, while exactly all bullet points or checkboxes are checked what we have to provide, and at least it's more people will receive. So with our partner Dr. Walter, the travel insurance is part of this, and there is the coverage is for acute illness, for example, or accidents during your stay abroad, which means you will arrive here in Germany, maybe you will break your leg, so go to the hospital will help you. So this is quite nice. Or if you have to, or if you need necessary medical treatments, for example, you can use Dr. Walter for this. Also, medicine or dressing materials prescribed by a doctor, no problem. But as said, this is just for a very short period in your life as a student, because in general you will come to Germany, let's say on the 1st of October, because the university will start on the 15th. You just need to use this insurance for 15 days. And the great thing is, and now I can also tell you a bit more benefits about our value package. This insurance would be free for 92 days, which means you do not have to pay any euro in the first 2 days. And the second great thing is, once Techniker Krankenkasse got activated, this travel insurance will be cancelled. So there won't be any hidden costs for you. You use it for 15 days, we pay it for 15 days, nothing more, nothing less. So don't worry, there won't come a bill from Dr. Walter or from Expatrio, which tell you, hey, please pay additional 100 euro or whatever. This won't happen. So in the first 92 days, as said, the insurance is completely for free. We will cancel it automatically for you. This is a great service. And that's basically all regarding the insurances. Just quickly step into the value package. So applying for the value package with Expatrio, you would receive a blocked account, you would receive incoming insurance, you would receive the Techniker Krankenkasse insurance, you would receive the current account also for free, which you can also open from abroad already. And then you will also receive a student benefit card from ISIC, where you can also save a bit money. And the great thing in the value package, you do not have to pay our setup fee of 49 euro. And this is what we can or what you can apply for while using the Expatrio value package. Bart, taking over to you now.
Absolutely. So, guys, it's first of all super important that you get a very good idea of why it is important. I tell you a personal story. I wanted to. So, as an exchange student from Technical University of Hamburg, you get a seat every single year at Seoul National University, and I really, really wanted to study there. I was like, all right, I'm saving money, 3,000 euros saved aside. But there was a screw up with the KKH that I was like insured with at that time, and it was just horrible because at the time when I saved up money for this, they asked me to just pay 1,800 euros to them, so I was left with 1,200 euros, and like definitely the plans with SNU completely did not work. So this is why I'm telling you, spend some time and go through this really nice page on Digis, where all of these things have been like covered in very detail. The different kind of health in these blocked account providers, what kind of packages do they have, and how much money you're saving. There are also some kind of like extra tips that you will find here that you might not find anywhere else. For example, that the German blocked accounts has to be with a German bank and on the name of the student and so on. So you can read all of that in a bit more detail here. And there's also a very detailed comparison towards the end. Now, so definitely take out some few minutes. Like if you're just still like distracted in 5 minutes and you cannot like go through it and have to watch some cat video, like then it will be just creating problems afterwards. Now, so another important thing, if I would have to like summarize everything that I read so far on this, the first thing is that the overall comparison kind of like favors towards Expatrio because of the very nice opening process that they have, and they have their own payment solution and everything. So when you pay the money, you must have seen on the Facebook groups that some students say that we transferred the money in the morning and the money came to us like money came to Expatrio within like 4 or 5 hours. So this is something that you can experience. Of course, don't rely on it like 100%. There are also exceptions, but you have seen these kind of stories like from students who are just coming forward and talking about these things. If I have to now summarize it real quick, Expatrio, affordable, easy opening process, and they have their own payment solution with Expatrio Pay, where you can like, pay with a lot of different kind of local currencies, and the activation process is super simple. Like you just have a login area, you can also upload the documents there, download the documents from there, which is very nice. With Coracle, like it's slightly cheaper and with an easy opening and activation process, but like there's a little flexibility in money transfer. Also, like most of the things you're doing with them is just like via email. So if there's some kind of sensitive information, which like emails are not so safe about, then it's like not that nice, because then on the other hand with Expatrio you can just have everything in one single dashboard, in one single login portal. With Fintiba, you're essentially like paying just a lot more money, for the same kind of things that you would get for a lot cheaper with Expatrio or other blocked account providers. So in general, like, just I wouldn't like at least recommend Fintiba to the students. Now, more of these details you can like just read into with this page. I'm going to put this afterwards in the YouTube's description, and you can just take a look at that. Now the cost savings part, I think like that is super important, and that is something I'm also just going to add real quick. If you compare Expatrio to Coracle, with Expatrio you can save around 86 euros. And if you compare Coracle with Fintiba, you can save around 141 euros. And if you compare Expatrio with Fintiba, with Expatrio you can save 227 euros. Now how does it come? Because like you also have to generally pay for your current account many a times, like depends on what kind of like bank account you're opening with, and with Moniz, like you're also like getting that additional benefit that you're getting the current account for completely free, like you're not just paying anything there. Nah? So, and then towards the end, if you compare Expatrio with Fintiba and even deduct the Moniz current account, you're still saving with Expatrio 156 euros. So this is a part where I don't see a sense at all like to at least go with these expensive solutions when you have like better solutions at hand. And you can just read about it. This is my personal opinion. You can still read about it, make your own informed decision, with the page that I'm going to be linking in YouTube's description afterwards. Right? And Dom, so do we go and jump into the Q&As now, or what do you have in mind?
Yeah, sure. So if some questions already addressed to you, let's do it. Of course, for answering questions, I'm here.
Perfect. That's super nice. So I think, Dom, the first very important thing which students were asking is about the mental health coverage. So does TK also has like coverage with like psychologists and so on?
This is a very special topic. There is kind of a coverage, but this is a thing I would always make sure to discuss if this is for free or if you have to pay, because many times or often this is maybe you have to go to a private person, and private people will charge. So this is exactly a thing you will find on the link we will share later on, if this is fully covered. And how many sections are covered. This is also important, because if I would say yes, it's covered, and then just 10 sections are covered, maybe you will come back to me and say, yeah, but your information wasn't 100% right. So this is always this thing. I would clarify. I would also clarify with whom you are talking. If there are some additional costs, just being on the 100% safe side.
All right, yeah. So like I can also like add something real quick to this. So a family member of mine, like they were going to psychologists, and generally like all of the costs were being covered by TK without any kind of like issues. But of course, like Dom said, like Dom is always like more particular, and he wants to give the entire information. So of course I cannot like tell you like it is going to be covered in every single case, but like in my experience there was one family member who was going to a psychologist, and like everything was covered very nicely, and there wasn't any issue at all. No? Okay, Dom, and I think another fun thing is the story of VFS and Dr. Walter. Like somebody wants to confirm that it's like all working right now.
Yeah, I'm super happy. And so this is how you can shock me sometimes. Barat knows me now, more than a year, and I guess I would say in general, I'm always super relaxed and focused on what we are doing. But sometimes things happened. As said, I got really shocked, and this was one case of this, because everything was set it up. So we made nice videos, and then I received this information. Hey, we have a big problem in New Delhi, and I said, no, it can't be true. So what I tried to do is to get immediately in contact with the embassy there. And I guess many people already took a look to the picture we posted. So it was super nice from them, because at the end they just had some personal changes, and maybe it was a chance to try new things. What maybe happened, and at the end everything was clarified. So as said, you can use Dr. Walter. It's a nice coverage, and from now on, I didn't hear any issues since 1 week, and I guess everything is done now.
Yeah, absolutely. So guys, that's super important to the thing is like VFS is always trying something different, right? Like VFS is this like external service provider to the German embassy, and sometimes the appointments don't work with them. Sometimes they have a stall of Bajaj Allianz right in front of their offices so that they can send the students and tell them, hey, like we are accepting only from them, and get a cut there. So these kind of like things a lot of students have complained about and have seen, but like this thing has changed right away, because like there was an email which was sent by this I think the legal department of German embassy, and they confirmed that like we have like told VFS again like that everything has to be taken care of in the case of Dr. Walter, that it is accepted, and you wouldn't face any kind of problems afterwards.
Yeah, and I'm super happy that we have direct feedback that it works,
Yeah.
which is good. So we are also dealing with some hurdles here from Germany sometimes.
Yeah.
But as said, at the end, we try to make it as easy as possible to relocate to Germany for you.
Dom, another fun question. Akhil Rajgopal is asking, I have a doubt regarding the blocked account payment. If I create an account in Expatrio and my account gets verified, then within how many months I have to make the blocked account payment?
Um, so we still have some people who applied last year and didn't transfer the money. So especially in the current times, I can completely understand that. Yeah, people are maybe not able to transfer that much amount in one payment or whatever. But don't worry. So you can open the account, and then yeah, we don't close it within a few weeks. So if you need some time, sometimes it's nice just to update our customer service team. If you will take maybe 3 months or even longer. But currently, for example, especially regarding Corona, we do not charge people for holding the funds here in Germany, which means you already transferred maybe the money and you say, okay, I don't need it currently, so I will store the money here in the Expatrio account. We do not charge you for this. And this is also, I guess, an important information for all of you. We always try to be super fair to you because we know very special times, sensitive topics. Um, don't worry about this.
Yeah, absolutely. Okay. Now, Tom, another, I think this is something related to the webinar one, like where we were still having these kind of like rule changes about when does the health insurance premium has to be yeah, paid. So one guy is
Yeah.
saying like the university is saying like, you don't have to pay because you are not in Germany right now, which is a bit interesting because university doesn't have a say. They are like, these are like the rules decided by the health insurance providers. What do you think about that?
Uh, lucky us till now. There's no update regarding the last time. So currently, the situation is like the following. Um, if you are doing your semester abroad while studying, for example, in India, and you won't come during the semester, you do not have to pay. Which means, let's say the semester will end on the 30 end of September. You will come to Germany in October. Then you just have to pay from October on.
Right.
Different case is if you arrive here during the semester. Let's say you will just write your final exams, for example, in Germany physically. Then you will arrive during the semester, and then you have to pay back from the beginning of the semester. This is the current situation. Lucky you that you do not have to pay if you stay fully abroad. Lucky you that you do not have to pay for the insurance as they planned before, because this was completely nonsense
Yeah.
to say it like this. Of course, paying for an insurance which you couldn't use for a few months, and then you have to pay one time
Yeah.
back, that also doesn't make sense. But I know Techniker Krankenkasse and I guess also other insurance providers are in contact
Yeah.
with the association. Till now, yeah, nothing changed, and it seems like to be that this semester will work, yeah, like more or less online semester, and then let's see how the winter semester will also look like.
Right, Dom, and within the same time frame, I had like another question from Akash Kumar, and he's saying my TK insurance is activated from India, and I'm attending online classes. I got the mail that to pay nearly 650 euros for health insurance. Please verify if I can pay that in monthly installments. So I think I would already say here that like this is the thing that we were talking about already in webinar one, that you should already start putting the money aside because the rules which were given out was that doesn't matter like where you're from, you still have to pay the money from the time you get enrolled in a German university. That's why all of us were saying like super important that you already start saving money on the side. So that's what I'm saying, guys. Like, there is possible that maybe some university say something like that, but like the general thing is that as soon as you get enrolled in a German university, in a public one, you have to get the public health insurance, and then the premiums are supposed to be paid from the time you get enrolled. Now that's why even if you're in India right now, you think like, all right, like it's not touching me at the moment. It might, nah. And the monthly installment thing, Dom, as far as I remember, like I was able to like do some monthly payments for the kakaha that I had what was previously. Like, do you think like DK would allow monthly payments, or should students get in contact with them?
Currently, as you do not have to pay money for this, I guess then you will just have this one-time payment. But in general, of course, there is an option. You can pay the full semester amount, which is around this €600, or you are also able that they withdraw monthly wise this 103 up to €105 from your account. This totally depends what the students prefer.
Okay, perfect.
But just also a hint I would like to share. If you will receive currently a bill that you have to pay the insurance, I would always get in contact with the university, also with Techniker Krankenkasse, just to clarify, because we have more than 400 universities here in Germany, and I don't know exactly how each university is dealing with this. To clarify, get in contact with them, to double check, get in contact with Techniker Krankenkasse, for example, and then you will receive a crystal clear answer what exactly to do.
Okay. Dom, Achal Gotadge is asking, what happens to my insurance when I start pursuing internship? Do I need to upgrade the monthly premium I pay? Please address this question.
No, then you have to let us know, or Techniker Krankenkasse to know that you are doing internship, and then you will be employed, and then maybe you have to pay a bit more for your insurance. It depends if this is mandatory internship, for example,
Exactly.
or something else. There are also two different ways, but always update the Techniker Krankenkasse or the insurance provider about the current state, because your employer will always do it. So company will send updated information to the insurance provider. So there won't be any chance not to pay for the insurance. But yeah, so maybe, as said, you will have increasing amount you have to pay, because you also receive a salary.
Okay, perfect. Dom, Sukun Bablani is asking, how much public insurance does one pay if the student is above 30 years of age?
It depends. So with Dr. Walter, it's a bit cheaper. It's around, I guess, 57 euro. But this is also a link we can easily share in the whole program here afterwards, which type of insurance they should apply then.
Okay, perfect. Right, guys, so this is also important. On Expatrio's website, on the FAQ page, you will find a lot of these things already. So like when you go there and like you start just browsing around on the website, at the very top there's written like authorities, blog, FAQ, contact and login. Go to FAQ, and then there you can read a lot of the things that they have compiled over the months and years, and like have been keeping updated in case like you need some kind of information regarding it. Most of the questions you would have will be already covered in this, no? So don't worry about that. And still, if you have some kind of questions, we are like having webinars anyways. This is only so that we can get in touch with you guys any type of questions you have or any kind of concerns you have. We can take it up, and that's why I'm also like super thankful to Dom that he's also like taking out time every single month. 1 hour, it's just dedicated to the students at the big community. So
just one thing to add, if you apply via Expatrio for the value package, for example, and we will ask you about your age, and if we figure out that you're above 30 years, don't worry, you can finish the application process. We just wouldn't hire you to Techniker Krankenkasse. We will direct offer you Dr. Walter insurance as a coverage then.
Sounds good. And Dom, Vikas Gunti is asking, I have a pre-existing critical medical condition. Will the health insurance cover my medical expenses? Is there any kind of waiting period for these particular kind of situations?
This is a good question. In the private one, of course, you have to play always with open cards. This is important. For Techniker Krankenkasse in general, this shouldn't be a problem. But if you need special medicine, for example, just get in contact with them if this is also covered, just to make sure.
Okay, sounds good. Another one, Shubham Nagre is asking, if I want to have health insurance and blocked account amount completely transferred to current account, then should I contact Expatrio? I think that's not possible, right? Of course, like otherwise it kind of like loses the entire purpose of having a blocked account. This is something I can understand because like Kotak Mahindra used to do these kind of things where they would ask students to just transfer all of the money into the Kotak Mahindra's Indian bank account, and then students go to Germany and they give the IBAN to the Kotak Mahindra branch in India, and then they transfer all of the money at once, which is like not how blocked account works. And many students face problem with that. That's why, like how Expatrio is doing that. The blocked account money is given to you in installments, 853 euros every single month. It is all your money, like nobody else is taking that money from you. So don't worry about it. Like you shouldn't have all of that money at once. Otherwise, you will have problems with the Ausländersbehörde there. All right, Dom. Then we have, does TK health insurance cover all the hospitals in Germany?
Yeah. Same answer as before. So you can go here, for example, in Berlin Charité, which is a really famous hospital. And then they will also have kind of a private station, which you have to pay additional fees. In general, if you have to go to a hospital, you can go there. Private hospitals in general are just charging extra amount of money.
Mm-hmm.
But let's say if we take a look to Munich, there is a hospital called, I don't know, Rechts der Isar. You could go there. Then in the university hospitals, so Universitätskliniken, you can go there. So this is in general. So people will always help you if there's a problem, and if you had, let's say, an accident, they will also bring you in the nearest hospital. So which means they do not check before, okay, is this person insured via Techniker Krankenkasse? And if so, we will bring you in a hospital which is maybe 200 kilometers away. That won't happen. So they will help you.
Okay. Nice. Rushikesh Purdi, a student from Big Academy, is asking if I can change the date of arrival, which can happen in this condition, and how many days I'll get the changed date documents of the travel health insurance. Any idea, Dom?
So we can update the insurance once you get in contact with our customer service team. So because currently I know what you try to ask is maybe you applied already few months ago and everything was closed because of the shutdown, and now you need to provide a new document. Just quickly get in contact with our customer service, and then we are able to upload and to update also the arrival dates.
Okay, sounds good. So this sounds good. Do we have some more interesting questions? Let me take a look. Okay, Nidisha is asking insurance premium for working students. So like Dom said, generally like it's possible that maybe if you're earning a lot of money during your internship, then like it could change, or even as a Vyak student, it is a possibility. But like then you have to like make a difference between mandatory internships and voluntary internships. So in those kind of scenarios, there could be some kind of differences. For these kind of scenarios, it would be best When you're in Germany, you directly like get in touch with TK, and like they would be able to guide you better, right, Dom? Or anything?
Exactly.
Okay, perfect. Shubham is asking like, what after 1 year? Like, do I also have to get blocked account for the second year?
Um, there you, I guess you can explain this also.
Right.
So sometimes the Ausländerbehörde will ask for extension, and if you have to extend, you can easily extend via the login portal. So we also help you and make this possible. And there are also some cases where you do not have to do. Is that right?
Yeah, absolutely. Because in some cities, I've seen one thing like they would just take a look at your current account and they will see, all right, like you're getting like money coming in every single month, and they'll be like, all right, fine, you get the extension without any kind of problems. In East Germany, many times I've also seen like students sharing that they just go once with like the blocked account money for 1 year, and like they get the residence extension for directly 2 years without any kind of issues. Then in Hamburg, I've seen like students have to like get the blocked account for the next year. So like it really depends on the local authorities and how they're handling things.
Welcome to Germany.
Yeah, a few things are like still like a bit different. Pavan Jan is asking, does TK Health insurance covers skin and teeth related issues?
So let's say you would like to go for skin cancer screening. This is covered. Yeah. So and if you need to go to the doctor, you can go to the doctor. For example, once a year, you always should go there just to refresh your teeth, and this is free of charge. So you do not have to pay for this. Zahnreinigung
Yeah.
in German. So this is a word maybe you should also write on your list. Zahnreinigung, really important.
Perfect. Now I think Alvin is asking, can we get health insurance after taking value package, or we can only get it together?
No, you can also upgrade in the login portal. This is not a problem. But if you apply for the value package, you will receive all the needed documents already within a few hours. So then you have everything set it up, and you do not need to do it once you're here in Germany, for example.
Perfect. So Mayank is asking, I think he has asked a lot of times. He's saying, what type of diseases are covered in travel insurance or TK insurance if while traveling from India to Germany I get COVID-19? Will it be covered?
Yeah, important question.
Yes.
So maybe we can quickly open Dr. Walter page to give an exact answer
Right.
regarding this.
I think from what I remember is like, I think we discussed it in webinar 1, and like there were like these health insurance services already saying like, if there's COVID, you get COVID on the way or something, like it will be like covered. But let's take a look here on the screen. You can take a look at Dr. Walters in the COVID area. So current information on coronavirus and your insurance coverage. You will find answers to questions about your travel, blah, blah, blah. Yeah, so I think like you can take a look at this here. Or like, Dom, do you already know?
So in general, it should be covered, but to make it 100%, because so then we can exactly take a look from when maybe you arrived and how the whole case is. They will help you here in Germany. So this is for sure. But this is a thing we could or let's double check here together.
Yeah.
Just a second.
I think I remember, but Dom.
Yeah, so here is written. So it's covered, and up to 90 days, kind of helping in the cases like treatments and so on, is also able to yeah, it's covered then.
Okay, okay. That sounds good, Dom. I think then that is it for the questions today. It was like again like super informative, and we are going to be sharing like some very detailed comparison of the different kind of blocked account providers, because you have to make sure that you are like not wasting your time or your money with places or like companies that you don't have to. So a very like detailed comparison for that will be posted in the YouTube video, and also as a summary of this live session in the Facebook post. So keep an eye out for that, and there you will read a lot more things. Definitely take out time for it. Dom, something do you have to add here?
Um, No, just as Berat said, take your time, read carefully. If there are some questions, please let us know, because then we can answer specific questions in an additional webinar. We will also post the coverage of Dr. Walter as a link that you can double check again. But as said, in general, it will be covered also during these Corona times. Yeah. Other than that, just to have to say, stay safe, take care, and yeah, hope most of you will be able to come to Germany and enjoy our wonderful country.
Absolutely. Definitely, Dom. Thank you so much for joining in this exclusive webinar again. And thank you everybody. Thank you everybody who was like watching the webinar and asking their questions. Of course, that is super important that you're making a very informed decision on what kind of like companies you're trusting with these kind of important bureaucratic processes when you're coming to Germany. So again, thanks everybody, and we'll see you in the next exclusive webinar in August, and the dates and the details for that will be coming up soon. Thank you so much.
See you. Bye.